In November 2024, an unsettling discovery stirred the waters of Europe, literally. A mutated polio virus was detected in the wastewater of Germany, Poland, and Spain. This finding, despite the existence of a highly effective vaccine, sent ripples of concern through public health communities. Poland's chief sanitary officer, Paweł Grzysiewicz, emphasized the potential danger this posed, particularly to the unvaccinated population. While those who have received the vaccine remain safeguarded, individuals who have opted out of vaccination, especially young children, are at an increased risk. The last recorded case of polio in Poland dates back to 1984, a testament to the effectiveness of vaccination campaigns. However, this recent development has prompted a call to action. Grzysiewicz underscored the necessity of updating vaccination records, particularly for children under 5, who are most susceptible to the virus. In response, authorities have proposed increased testing of wastewater and the regular replenishment of polio vaccine stocks to ensure readiness. The primary concern voiced by Grzysiewicz and echoed by health officials across Europe is the potential spread of the virus via the feces of infected individuals, as well as through contaminated food and water sources. This scenario raises alarms about the virus's ability to traverse borders, prompting a re-evaluation of preventive measures. France, for instance, has already implemented mandatory vaccinations against 11 infections, including polio, in the wake of a 2017 measles outbreak. Italy has similarly strengthened its vaccination policies against 12 prevalent diseases, while Germany enforces a Measles Protection Act, mandating vaccinations not only for children but also for educational institution staff. These varied approaches across Europe share a common goal: halting the spread of infectious diseases. One possible factor contributing to the resurgence of polio in Europe is the ongoing conflict in Ukraine. The World Health Organization has cautioned that the insufficient immunity levels among the Ukrainian populace make it particularly susceptible to poliovirus transmission. This situation underscores the interconnectedness of public health efforts and geopolitical dynamics, highlighting the urgent need for collaborative solutions. Polio, a formidable viral adversary, spreads through the fecal-oral route and can lead to paralysis and long-term disability. Children under the age of 5 are especially vulnerable, making vaccination an imperative defense. While there is no cure for polio, immunization remains the most effective shield against its debilitating effects. In Russia, Anna Popova, head of Rospotrебnadzor, reassures that the country's infection prevention system operates efficiently, with an impressive annual vaccination coverage of 96%. This high level of immunization provides a robust barrier against potential outbreaks. Regions bordering Ukraine receive particular attention, with health officials like Tatiana Odinets, Crimea's chief specialist in infectious diseases, acknowledging the risk yet expressing confidence in the protective power of widespread vaccination. As the narrative of this viral threat unfolds, it becomes clear that vigilance and proactive measures are paramount. The mutated strain discovered in the wastewater of these European nations serves as a stark reminder of the virus's tenacity and the ever-present need for comprehensive public health strategies. The historical context of polio, once a rampant scourge before the advent of vaccines, adds a layer of urgency to current efforts. The disease's ability to resurface, even in regions where it had long been vanquished, underscores the importance of maintaining high vaccination rates and rigorous monitoring systems. In the backdrop of these developments, the role of scientific innovation and community collaboration becomes increasingly crucial. The resurgence of this virus in countries with robust healthcare infrastructures raises questions about the factors contributing to vaccine hesitancy and the spread of misinformation. It challenges public health officials to double down on educational campaigns that highlight the life-saving benefits of vaccines. The goal is not only to protect individuals, but to fortify communities against the spread of preventable diseases. The intertwined fates of Europe and Ukraine in this public health narrative also illustrate the broader implications of geopolitical tensions on disease spread. The conflict in Ukraine, with its resulting displacement and disruption of healthcare services, creates fertile ground for the virus to gain a foothold. This situation presents a compelling case for international cooperation in public health initiatives. By sharing resources, expertise, and support, nations can collectively bolster their defenses against the virus's advance. In this intricate web of challenges and responses, the The real heroes are the healthcare workers and policymakers who strive tirelessly to safeguard the public. Their commitment to overcoming logistical hurdles and addressing the needs of vulnerable populations is both commendable and essential. The story of polio's resurgence is as much about these individuals' dedication as it is about the virus itself. As countries navigate the complexities of ensuring adequate vaccine supplies and implementing effective public health measures, the lessons from past epidemics ring loudly. The global eradication of polio hinges on sustained efforts and unwavering resolve. The stakes are high, as is the potential for success if communities rally together. The history of polio, marked by devastating outbreaks and remarkable triumphs, serves as a testament to human resilience and innovation. In contemplating the future, one must ponder the balance between individual freedoms and collective responsibility. The decision to vaccinate is deeply personal, yet its repercussions extend far beyond the individual. This interconnectedness is a defining characteristic of public health. It reminds us that the health of one is inextricably linked to the health of all. As we reflect on the current situation, we are called to consider our role in this shared narrative and how our actions today will shape the world of tomorrow. As we delve deeper into the intricate dynamics at play, the story of polio's reappearance in Europe becomes a microcosm of larger public health challenges. The mutated strains identified in Germany, Poland, and Spain highlight the unpredictable nature of viruses and the perpetual need for vigilance. In an age where scientific advancements have made eradication conceivable, the reemergence of such a disease serves as a humbling reminder of the delicate balance we must maintain to protect public health. The historical journey of polio, from its devastating impact in the early 20th century to the groundbreaking development of vaccines, is a testament to human ingenuity. The disease, once a source of widespread fear, saw significant declines thanks to coordinated vaccination campaigns. However, this recent discovery in Europe suggests that complacency can be a formidable adversary. Continuous efforts are required to ensure that vaccination programs remain robust and that public trust in these programs is maintained and strengthened. At the heart of this issue lies the challenge of addressing vaccine hesitancy. Misunderstandings and misinformation about vaccines are not new phenomena, but their repercussions can be profound. In societies where access to information is abundant, the spread of unfounded fears can undermine public health initiatives. It is crucial for health authorities to engage with communities, listen to concerns, and provide clear, evidence-based information to counteract myths and misconceptions. By fostering a culture of transparency and trust, health officials can encourage informed decision-making and bolster vaccination efforts. The narrative of polio's return also brings to light the significance of cross-border collaboration. Diseases recognize no boundaries, and in our interconnected world, the health challenges faced by one nation can quickly become a global concern. The situation in Ukraine illustrates this point vividly. The conflict and its impact on healthcare infrastructure have heightened the risk of virus transmission, not just within Ukraine but to neighboring countries as well. This calls for a unified response, with nations pooling resources and expertise to support those most in need. In this context, the role of international organizations like the World Health Organization becomes indispensable. By coordinating efforts, setting global standards, and facilitating dialogue among nations, such organizations play a pivotal role in the fight against infectious diseases. Their work underscores the importance of a collective approach to health challenges, one that transcends political and geographical divides. As we consider the broader implications of these developments, it becomes clear that the fight against polio is not merely a medical one. It is a battle against complacency, misinformation, and the barriers that divide us. The stakes are high, but so is the potential for triumph if we remain committed to the principles of collaboration, innovation, and compassion. The lessons learned from this situation can serve as a blueprint for addressing other public health challenges, reminding us that together, we can overcome even the most formidable obstacles. In contemplating the road ahead, the journey of combating polio offers both cautionary tales and inspirational narratives. It beckons us to reflect on the broader implications of public health decisions and the role each of us plays in shaping a healthier future. As the mutated virus circulates in Europe, it serves as a poignant reminder of the interconnectedness of our world and the shared responsibility we hold in safeguarding it. The resurgence of polio in regions once deemed polio-free brings to light the essential need for resilience in our public health systems. This resilience is built on a foundation of comprehensive vaccination programs, continuous surveillance, and adaptability in the face of new challenges. It calls for a renewed commitment to scientific research and innovation, ensuring that our strategies evolve in tandem with emerging threats. The story of polio is not static. It is a dynamic tapestry woven with the threads of past victories and present challenges, urging us to remain vigilant and proactive. For American men aged 40 and older, this narrative holds particular significance. It serves as a call to action, not only to protect oneself and loved ones, but to advocate for the health of future generations. The decisions made today regarding vaccination and public health policies will reverberate through time, influencing the world our children and grandchildren inherit. By staying informed and engaged, individuals can contribute to a collective effort that transcends individual boundaries and fosters a culture of health and well-being. As we conclude this exploration of polio's impact and the ongoing battle to eradicate it, we are left with a thought-provoking question. How can we, as a global community, ensure that the lessons of the past guide us toward a future free from the fear of preventable diseases? The answer lies in our ability to learn from history, to support scientific endeavors, and to cultivate a sense of global solidarity. By doing so, we honor the countless lives impacted by polio and reaffirm our commitment to a healthier, more equitable world. In a world where information flows ceaselessly and challenges abound, let us choose to be champions of truth and advocates for health. Let us inspire others to join in this vital mission, encouraging dialogue, understanding, and action. By subscribing to this channel, liking this video, and becoming part of this community, you become a crucial participant in this ongoing narrative. Together, we can illuminate the path forward, ensuring that the legacy we leave is one of hope, resilience, and unyielding determination to create a world where health is a shared and universal right.